entering and leaving the room. Order, order. Dan Carden to move the motion.
Yeah. Thank you, Ms Favag. It's a pleasure to serve under your chairmanship. I beg to move that this House has considered Dame Carol Black's independent review of drugs, and I refer members to my entry in the Register of Members' Interests. The public provision we currently have for prevention, treatment and recovery is not fit for purpose and urgently needs repair. That is a damning conclusion of Part 2 of Dame Carol's review, setting out a way forward on drug treatment and recovery. And I've called this debate today because the recommendations in this report are too important to be left gathering dust on ministerial bookshelves. I want Dame Carol's words ringing in ministerial ears. She says government faces an unavoidable choice: invest in tackling the problem or keep paying for the consequences. A whole systems approach is needed. This part of my review offers concrete proposals, deliverable within this Parliament, to achieve this. She calls for significant investment, but the payoff is handsome. Currently, each £1 spent on treatment will save £4 from reduced demands on health, prison, law enforcement and emergency services. And understandably, Dame Carol is hopeful that her recommendations will be welcomed by this government, as, in her words, they strongly support its crime reduction and levelling up agendas. The 32 recommendations we have are a gift to this government, and they should be a moment for change. And I think it's fitting that this debate comes on Budget Day, a reminder that the economic cost of drug misuse is upwards of £20 billion each year, and yet the spending on prevention and treatment stands at just £650 million. And these recommendations give hope that real change is possible. Addiction is a national crisis. Drug and alcohol-related deaths are now the highest on record at the very moment that treatment services are most ill-equipped to deal with the soaring need. Forward Trust estimates that over 2 million people are in need of help with alcohol, drugs or gambling. And their recent YouGov poll showed that 64% of people said they knew someone personally struggling with addiction. And since I talked openly about my own personal experience of addiction and recovery, I've been overwhelmed by the thousands of people who have reached out to me to tell me their personal stories, firstly of the horror of addiction, but also of the blessings of recovery. The tragedy is addiction is everywhere, and yet it remains so well hidden. In 2019, Dame Carol was commissioned by the then Home Secretary, the member for Bromsgrove, to independently review illicit drugs in England. And I want to thank Dame Carol Black for her commitment and dedication over the last few years, and to all those who've contributed to this groundbreaking report. Most of all, I hope that my contribution today does justice to the absolute clarity that Dame Carol brings to what are incredibly complex matters. Part 1 of her review was published on the 27th of February 2020 and made for uncomfortable reading. The unflinching analysis detailed the extent of drug-related harm and the challenges posed by drug supply and demand, including the ways in which drugs fuel serious violence. The Department for Health and Social Care swiftly commissioned Dame Carol to produce Part 2 of her independent review. This focused on how to improve the funding, commissioning, quality and accountability of drug prevention, treatment and recovery services in England. Part 2 of her report, published in July of this year, pulls no punches either. It says, funding cuts have left treatment and recovery services on their knees. Commissioning has been fragmented with little accountability for outcomes, and partnerships between local authorities, health, housing, employment support and criminal justice agencies have deteriorated. It goes on. The workforce is depleted, especially of professionally qualified people, and demoralised. Vital services have been cut back, particularly inpatient detoxification, residential rehabilitation, specialist services for young people, and treatment for cannabis and stimulant users. I'll give way.
Can I commend them for bringing this to Westminster Hall for debate and for discussion, which he has very clearly done. But does the honourable member not agree that more should be done to ensure that alcoholism, in particular, is also treated urgently and similar to drugs, and that help needs to be given to families for rehabilitation, which the honourable member has referred to, not in a punitive fashion, which some people would like to do it with, but instead to help draw people away from their addiction. It has to be done in a way that people wish to get away from their addiction and try to move forward.
Absolutely. I think that's a valuable intervention, and it's good that we've got a health minister here today responding to the debate, I think, because it is a health response joined up across government that this issue calls for. Part 2 of the report goes on to say areas of the country with the highest rates of drug deaths or the poorest treatment services are the very same areas where the need to level up is greatest. These communities want to see urgent and effective action to tackle the violent drugs market alongside purposeful efforts to rebuild treatment services and recovery support so that people can get the help that they need. I will, one last time, and then I'll carry on.
I thank the Honourable Gentleman for giving way. He's making an excellent speech, and I very much endorse and support the recommendations of Dame Carl Black's review. But I've heard her present these reports, and she was very clear that the framework that she was given, the parameters she was allowed to look at, excluded deliberately any review of the legislation that frames this whole matter. Now, given that this is a very unique health pandemic because the victims of it are liable for criminal prosecution if they actually seek help, and many of those who wish to help them would be liable for criminal prosecution if they try to do so. Is it not time for the government to actually begin a review of the Misuse of Drugs Act and have a more up-to-date way of having a legal framework to deal with these problems? And wouldn't that assist the implementation of Dame Carl Black's recommendations?
Thank you, Ms Vervogue. And the member makes an important point, but it's one that I'm not going to get drawn into today. A month after Part 2 was published, the ONS confirmed that drug-related deaths had hit an all-time high in England and Wales, the highest number of deaths since records began. Drug deaths have risen 60% in the last decade. In 2020, 4,561 people lost their lives to drugs. And each life represents years of pain and suffering. Each life lost leaves a family devastated and shattered irreversibly. And each life lost is evidence of a missed treatment opportunity. Most importantly, I think for us here today, each life lost, I think it's important to accept, is a failure of policy too. I want to make special mention of the stigma that surrounds addiction. Someone who finds themselves dependent on a substance deserves the evidence-based health treatment and support that works, and yet stereotyping and prejudice remains all too common in our approach to addiction. It was disappointing to see the government's response to the review referring to addiction as a scourge on society. I think the dehumanisation of people who become drug dependent feeds into the stigma that actually we must eradicate. And so we must steer the discussion, the policies and treatment towards a compassionate and person-centred health response. On this, last week, I joined the Forward Trust at their campaign launch, Taking Action on Addiction, which aims to improve public understanding of addiction as a serious, chronic mental health condition. And the Duchess of Cambridge, patron of the Forward Trust, spoke there, and I want to quote her at length. She said, "Addiction is not a choice. No one chooses to become an addict, but it can happen to any one of us. None of us are immune. Yet it is all too rarely discussed as a serious mental health condition, and seldom do we take the time to uncover and fully understand its fundamental root causes. The journey towards addiction is often multi-layered and complex, but by recognising what lies beneath addiction, we can help remove the taboo and shame that sadly surrounds it. As a society, we need to start from a position of compassion and empathy. 80% of the public support more treatment and care for people struggling with addiction, and less than 10% believe more punishment and condemnation would help. Intolerance, shaming, tougher punishments and denial will not rid society of addiction, because addiction is an illness. It's a matter of public health, and Dame Carol puts it best when she says it must be recognised that addiction is a chronic mental health condition, and like diabetes, hypertension or rheumatoid arthritis, it will require long-term follow-up. Sadly, as things stand, I cannot think of another illness that causes so much harm to society, that is given so little, and that for those who are suffering, they can actually be treated with such contempt. It's the only illness in which blame is placed on the person suffering. Instead of blaming the individual for making bad choices, we need to ask why so many people are turning to substances in the first place. And so now to the prevention, treatment and recovery system as it stands. Not fit for purpose, in urgent need of repair, years of austerity, continued disinvestment, fragmentation and a dire lack of accountability throughout. The Health and Social Care Act 2012 shifted addiction treatment out of the NHS mental health services onto local authorities. At the very same time, budgets were being slashed. And on this, Dame Carol is clear. Funding for drug treatment must be allocated to local authorities based on a needs assessment and then protected. We also need to urgently improve the situation for people suffering co-occurring mental ill health and drug or alcohol dependency. Too many people are being bounced between fragmented services and end up falling between the cracks. It's simply wrong that mental health services can require patients to reduce their alcohol or drug use without providing the proper support to do so before they can receive the treatment they need, or that drug and alcohol services don't possess the competencies to support someone with significant mental health issues, thereby often leaving sufferers with no support whatsoever. There must be a no wrong door policy. One young woman, who I'll call Jane, told me it was as if I had to get more ill, drink and use more until I got the right help and support. For 18 months, my mental health deteriorated. Mental health services couldn't help me, and addiction services struggled to support me because of my poor mental health. I was so frightened, I had to reach crisis point and rock bottom before I was able to be considered for residential treatment. Jane is now in recovery and living a happy, healthy life, but she didn't receive public funding. In fact, she was denied it. If it wasn't for a chance meeting with Action on Addiction, who provided her with a bursary-funded bed, she wouldn't be alive today. And it shouldn't, quite simply, fall to charities to catch the increasing numbers of people falling through the threadbare safety net. Access to treatment should not be about luck, only available to those who can afford it or those who live in a local authority that prioritises it. Currently, the drugs treatment market operates in a very similar way to that of adult social care. Providers are being squeezed, staff being paid poorly, there's a high turnover in the workforce and a depletion of skills. And the number of medics, psychologists, nurses and social workers in the field is falling significantly. It is time to repair this broken system, to overhaul addiction treatment, and here we have the roadmap for the future, the 32 recommendations of Dame Carol Black's independent review of drugs. The scope of the recommendations is far-reaching, and the solutions span many government departments, local governments and other organisations. Dame Carol's review has pursued three main objectives: to increase the proportion of people misusing drugs who can access treatment and recovery support, including more young people and earlier interventions for offenders to divert them away from the criminal justice system. to ensure that the treatment and recovery package offered is of high quality and includes evidence-based drug treatment, mental health and physical interventions and employment and housing and support. And thirdly, to reduce the demand for drugs and prevent problematic drug use, including use by vulnerable and minority groups and by recreational drug users. And to achieve these objectives, significant changes need to be made in 4 areas: radical reform of leadership funding and commissioning, rebuilding of services, increased focus on prevention and early intervention, and improvements to research and how science informs policy, commissioning and practice. And the 32 recommendations cover a wide range of responsibilities. But I want to make clear to the Minister, Dame Carroll has made absolutely clear that the 32 recommendations must not be cherry-picked. This is a whole systems approach, and when you attempt to pull that system apart, the whole system will collapse. The government has already begun to set in motion some of the structural changes, and I welcome that, and policy commitments that will help drive through the review's recommendations. And it's reassuring that Dame Carroll herself will continue to act as an independent advisor to government. But the remaining recommendations are contingent on government investment. In January this year, the government announced £148 million of new money to cut crime and protect people from the harms caused by illegal drugs. And I welcome this money, 80 million of it to be invested in treatment and recovery. That 148 million must be the first instalment of the 1.78 billion Dame Carroll has called for over the next 5 years. And I hope the Minister has come with hot off the press budget commitments. Dame Carroll's spending recommendation would return addiction treatment back to what it was before 2012. Whilst local authorities are well positioned to oversee services, drastic cuts to public health grants have led to cuts to addiction treatment services over many years. The Local Government Association have long argued that reductions to the Council's public health grant, which is used to fund drug and alcohol prevention and treatment services, is a false economy, which will only compound acute pressures for the criminal justice and NHS services further down the line. If the Treasury is unable to find the funding that this review calls for, I do want to stress with the Minister that the money it does find must not be thinly spread across the country. Rather, it should be targeted at those areas most in need, and efforts must be made to at least pilot the whole systems approach that Dame Carroll has called for. Small amounts of money to each local authority will not bring about the long-term transformational change the review demands. And to finish, Ms Favog, there has simply never been the political will to act on prevention, treatment and recovery from drug and alcohol harm. But we have reached a crisis point, with record deaths, rising economic and social harms and depleted treatment services. Dame Carroll's groundbreaking review, commissioned by this government, is the moment for change, and the government cannot meet its pledges to level up deprived, often northern communities that it seeks to represent unless it does this. In the words of Dame Carroll, the government must either invest in tackling the problem or keep paying for the consequences. Thank you.
The question is that this House has considered Dame Carol Black's independent